Wish everyone a happy opening day, a wonderful annual day, and we wish our San Diego Padres the very best, both today and throughout the season. Today is also opening day for a new tier of vaccines. We have moved into the 50 and older are now eligible to get the vaccine. And we have seen jumps in the supply of vaccines. It's still not enough to meet the need, and it's still not enough to meet the capacity that we built out, but we are encouraged at where we've gone. A few weeks ago, we saw a 9% increase. A little bit later, it was a 10% increase, eventually became 15. And last week, we ended up receiving almost 25%, about 23% more than what we had gotten the week before. And our projections for next week are about the same, not in terms of an increase, but about the same for next week what we got this week. But it's always possible that you get some last-minute shipments and things that come in. So in general, as we open up more tiers, we know there continues to be tremendous demand on the vaccine system. We ask folks to continue to be patient, but right now we have expanded, as has the entire state of California, for those 50 and older are now eligible, regardless of underlying health conditions, to get vaccinated. And we're looking ahead to the middle of the month, 2 weeks from now, when it will essentially go to everyone. And so we do expect the supply of vaccines to continue to significantly increase. Again, our internal capacity, just to the public network of sites we've built in partnership with our partners, continues to be about 35,000 a day. We have not hit the supply to get us to that point. We also have plans in place where we could surge to do 50,000 a day at our network of vaccination sites. And again, that is additive to what the healthcare systems and the VA and other folks are doing on their own. But continued progress around efforts surrounding vaccines. We do also see continued progress on efforts around moving into the orange tier. We did now have 2 consecutive weeks at what will be in the orange tier when the state hits that 4 million mark for vaccines in the top HPI quartile. We are not there yet. But at the point that we arrive there, then as a region, we should be prepared to move and descend into that orange tier. We don't know how long it will take. Obviously, you can track the number of vaccines statewide have been done in that. I think we're at about 3.4 million in that top quartile right now. We need to get to 4 million. But once we hit that 4 million, then the tier numbers revise, and San Diego at that point would be eligible to descend into the orange tier. So perhaps as early as next week, but again, we are headed in the right direction. And we're headed in the right direction, again, because our case numbers continue to be very stable. And that is encouraging. We're obviously seeing other states, New Jersey, Connecticut, Illinois, that are facing a different situation. But here in San Diego, we're doing well. I think the vast majority of folks continue to be careful, to be safe, to utilize the face coverings. And because of that, we are not seeing an increase in our cases. And that is what is putting us in a good position to continue to descend with more things coming open. Supervisor Vargas is going to talk a little bit about our health equity program and efforts in a second. We continue to exert tremendous effort and energy to ensure vaccines are available in the communities that are hardest hit. I also wanted to share that for homebound San Diegans, we are expanding the homebound seniors program to homebound San Diegans, regardless of age. They can call 211 to get on a list, and then our aging and independent service folks screen to ensure they truly are homebound. And we have a number of providers that are helping us catch up the backlog of homebound San Diegans, but now it is homebound San Diegans and not just homebound seniors. Before we hear from Supervisor Vargas, let me walk through a couple of our charts real quick, just 3. The first is just the dashboard. Again, you continue to see tremendous efficiency at getting doses administered as quickly as they are arrived, as quickly as we possibly can. Now pushing 1.7 million total doses administered. We're approaching almost 1 million San Diegans that will have received at least their first shot. This represents 35% of those 16 and older who are eligible. And more than 20% of San Diegans are now fully vaccinated, more than 1 in 5. And so again, tremendous thanks and appreciation to all of our healthcare system partners, county staff, everyone who's out there, firefighters, paramedics, everyone who is a part of this incredible vaccination effort, who's helping us move forward. The next one you'll see right here is just our cases. And again, you just see general stability here. Our percentage of positive remaining relatively flat right where we are. Number of cases, they go up and down a little bit each day, but But again, generally in that 200 to 300 range, and we think this is a very encouraging sign. I want to reiterate that the goal from the beginning of our COVID response was to slow the spread of cases to not overwhelm the healthcare system. And so with the presence of the vaccine, it is much easier to do that, and that's why we look forward to continued phased and safe reopening, but continuing to head in a positive direction. And then the last chart here just shows you our somewhat complicated chart here. Most important numbers there are down at the bottom left, the 4.9. Though that is our case rate that came out on Tuesday. Right now it is in red, but again, once we hit that 4 million number statewide of number of vaccines administered in that first HPI quartile, then the numbers change. And the numbers that are now red would be orange. And so as long as we stay at 5.9 or less, once we hit that 4 million mark, then we would be eligible to descend into the orange tier, which would increase some capacities for a lot of entities, gyms, restaurants. More folks would be eligible to go to Petco Park, and we'll continue to work our way out of that. So again, this could happen as early as next week. We don't know exactly when because we don't know the pace or trajectory of statewide vaccines. With that, let me turn it over to Supervisor Vargas for her update, and then we'll take your questions, and Dr. Wooten is here for questions as well. Thank you.